everybody. Thank you so much for being here to discuss this important issue. My name is Eli Ungard from the Jewish Home Family. It is my pleasure to introduce our CEO, Carol Silver Elliott.
Good morning, everybody. Thank you so much for being here. I am now going to stand behind the podium because I disappear. So I'm going to stand over here, and I'm going to try to do this without a microphone. We are extremely excited today to be announcing the opening of the SeniorHaven Center for Elder Abuse Protection here, Elder Abuse Prevention here at the Jewish Home Family. And what we're going to talk about this morning is a little bit about elder abuse in general, and then we're going to talk about our project specifically. Elder abuse is really a story about people. Elder abuse, I'm going to give you numbers. I'm going to talk to you about the kinds of abuse. I'm also going to talk to you about the things that we do. But elder abuse is really the story about people one at a time. I have had the privilege previously in my career to have opened an elder abuse shelter in Ohio. And I have to tell you about some of the people whose lives we really touched. The second victim that we took into our shelter was a woman whose name was Ruth, although she preferred to be called Sammy. Sammy had been living her life completely controlled by her daughter and her granddaughter, who had moved back in with her after many years. Both of them had arrest records, both of them had substance abuse issues, both of them had lived very rough lives. Sammy thought she had done everything she could for her children and her grandchild, but it didn't work out as well as she had hoped. And she ended up in a situation where she was financially exploited, physically abused, and completely socially controlled. What happened to Sammy? Sammy had gone to the doctor, and she never made the follow-up visits. And the doctor's office started to call, and eventually they began to realize that something wasn't right in Sammy's life. And they called one of our great partners in this work, and that's Adult Protective Services. And APS went to the home and asked Sammy if she wanted to come to shelter. What does it mean to come to shelter? Shelter means that you have to sever that relationship with the abuser, at least for a period of time, until you have an opportunity to heal and to figure out what's important to you in your life. So Sammy came to shelter. She was terrified. She wouldn't speak. She wouldn't leave her room. She couldn't walk. I will tell you that after 90 days in shelter, with rehab and other services, Sammy was walking. Sammy was beginning to open up and tell people her story. Our policy there, as it is here, is that we don't keep victims. From the minute that they are admitted, we begin planning for discharge to the safest and least restrictive alternative. But Sammy, staff fell in love with Sammy, and a little bleeding goes a long way, so we kept Sammy. And 2 years later, I had the privilege of watching Sammy stand up with a microphone and sing in Bellfire. She'd never sung in public before in her life. She'd never had the courage to perform anything. She'd never had the opportunity. This was a woman who would only let us photograph her from the back, who still lived in fear every day that her daughter and granddaughter were going to find her. The difference we made in Sammy's life was the difference between a horrible end of life and a respectful and dignified end of life. It's really the story of one person at a time, and that's what elder abuse prevention is all about. There are really two pieces of this puzzle. One is the opportunity to provide shelter and help people, but the other critically important part is the opportunity to do exactly what we're doing here today, and that is to begin the process of educating people. Because all of us need to understand what elder abuse is, what to look for. I promise you, if you dig deep, you will think about an instance that you thought, maybe the circumstance isn't quite right. Maybe there's something going on here that isn't exactly the way it should be. When we started talking about shelter, and Brooke Santoro's here from the Weinberg Center at the Riverdale Hebrew Home. The Weinberg Center is the first shelter in the country, opened 10 years ago, and we're very, very happy to have Brooke here this morning. We started talking about shelter with the Weinberg Center team as we did here. I remember saying, as we got off that first conference call, oh my gosh, this is an opportunity to help people we haven't helped before. And as soon as the words left my mouth, I remembered one of my very favorite residents, Sylvia Herman. Sylvia has since passed away, but Sylvia was one of the first residents I met when I came to Cedar Village. She was the president of the Tenants Association. She's about this big. She made me feel tall. Feisty little lady who had turned over all of her assets to her daughter. She lived in our assisted living. One day her daughter stopped paying her rent. She couldn't get her daughter out the phone. Her daughter had cleaned her out of everything, and she never saw her daughter again. That's elder abuse. It's all around us. We see it, we experience it, but we don't know what to call it, and we don't know what to do about it. We hope this is the first step in helping people not only recognize it, but know what to do about it. So how big is the problem? We know that the problem in this country, and actually the Elder Justice Project just did a very significant study that we give you copies of. We know that the problem in this country is somewhere between 3.5 and 5 million older adults every year. Every year. Research indicates that 1 in 10 older adults experience some form of abuse, and only 1 in 24 cases is ever reported. When we talk about elder abuse, what is elder abuse? Part of the definition of elder abuse is that it's abuse that takes place at the hands of a trusted caregiver. And that element of trust and relationship is one of the critical components of understanding elder abuse. We all hear about scams, people who go to someone's door and sell them, a $100,000 roof that they don't need. While that is financial exploitation, elder abuse is a more insidious problem, because it often occurs over a long period of time, and it occurs in a way that people aren't necessarily aware of, starting with social isolation and leading to all of the other elements of elder abuse that we are aware of. Elder abuse triples the risk, according to research, triples the risk of premature death. It also causes unnecessary illness, injury, and suffering. So if you were to put on sort of your business hat and think about this, start to wonder what it also does in terms of healthcare costs in this country. What happens in terms of some of the costs specifically around Medicaid, but also potentially Medicare, for these people who are incurring medical bills and expenses because they are the victims of abuse. Abuse is all of the kinds of abuse that we are aware of, and we have some of our friends here who work in the domestic violence space, Elaine Myerson from the Center for Health and Safety. Did I get that right? Sometimes I flip those two words. So, they understand what abuse is all about. It's the same for elder abuse. We're talking about physical abuse. We're talking about emotional abuse, physical abuse, sexual abuse. With our older adults, neglect can also be an important piece of this. This is the older adult who's not getting the care that they need, that's left in dreadful circumstances for a period of time, who really suffers abuse at the hands of someone who is passively, perhaps, or actively neglecting them. In almost every case, and I have yet, and Brooke, maybe you have, but we have yet to see a case where financial exploitation is not a piece of the puzzle. It may start there, it may end there, but it's always there. As age increases, we also know that the number of social and psychological issues that make people more dependent and consequently more vulnerable increases. And we all know this. This is just logic. As people get older, they're suffering with chronic diseases, they have medications that they need, perhaps they're depressed, they have dementia. All of these things contribute to the prevalence of elder abuse. I read a statistic yesterday linking the prevalence of dementia to increases in elder abuse. We understand, and I think all of us who have worked in this field understand, that caring for someone with dementia brings along its own level of stress, right? It is not an easy thing to do. But where it crosses the line into elder abuse is a whole other subject, and that's one of the things we want to talk about today. Our older adults are extraordinarily vulnerable, particularly our victims, much like victims of domestic violence. And yet it is a little bit different in the fact that many of these victims are truly dependent upon their caregivers in some respect, either to support them or to provide physical care. There is that relationship. One of the statistics we also know is that elder abuse increases as age increases. So the biggest at-risk population, anybody want to tell me? Over 85? Over 85 and female. women are much more at risk than men. And actually, that's the next slide. Sorry, Ezra. All of the social isolation is a big piece of this. Victims in poor physical health are also at risk as well. Elder abuse can occur anywhere. I've done a lot of speaking around the country about elder abuse, and sometimes when you talk, I presented in front of the Ohio legislature last year, and the big conversation was, what about facility-based abuse? What about facility-based abuse? Facility-based abuse is not the big ticket item here. We are all in this industry regulated. We have lots of supervision. Certainly I think I can speak for the nonprofit sector where the care is very resident-centered and very compassionate and is not as at risk perhaps as in a different kind of setting. But by and large, this is an industry that is paying attention. It is not the facility-based abuse that is the bigger concern. If there is an episode of abuse, if we see a caregiver that is not behaving in an appropriate way, and I can say this with absolute certainty, we see it, we remove it. Whether that's a caregiver that belongs to us, whether that's a private duty caregiver that's in the building, even a family member that we see behaving in a way that seems abusive towards a resident, we call it, we deal with it. But what happens in the home is very different. It's a very different set of circumstances. We just had a case in our adult daycare center within the last 2 weeks where we had a resident who's being cared for completely by a private duty caregiver. This resident has injuries. This resident has injuries that don't make sense. The state is now involved. We're looking at what those circumstances are because we recognize that there's a situation here that doesn't feel right and that potentially is abuse. Why don't people report elder abuse? They don't report elder abuse because they are ashamed, they are afraid, they are embarrassed. Think about it. I just told you that the people who are likely the abusers, right, are the children and the grandchildren in many, many cases. Spouses occasionally, but children and grandchildren. When you are in a situation where it is your loved one who is your abuser, someone that you raised, someone that you taught values to, someone that you feel responsible for, and they turn around and are your abuser, it is a very embarrassing set of circumstances. People are in denial. People don't necessarily want to admit that they are in a terrible situation. In addition to that, we also know that people are reluctant to separate from their things, their homes. The abuser almost always has moved into their home or their apartment. They're taking their space and their stuff. So when you say to someone, are you willing to come to shelter? They say, but what about my things? What about my home? How am I supposed to leave all of those things? The other big issue we see with a lack of reporting of elder abuse is the fact that people don't always yet believe, right? When someone goes to the emergency room because they have a severe injury with their abuser, and the older adult is questioned and says, well, this is what happened, or maybe they're very slow to be able to respond, and the adult child, perhaps, who's the abuser, jumps in and says, oh my gosh, she's so clumsy. She's so clumsy. She's always falling over something. Who gets believed? Who gets believed, right? We see the same thing in other professional settings. I did a presentation, again, in Ohio for the Cincinnati Bar Association, and I talked to some of the attorneys in the room about whether they actually ask the older adult alone about whether or not these are their decisions. They don't. Oftentimes they don't. You know, because someone is older doesn't mean that they can't speak for themselves or tell you their story. Because someone has dementia does not mean that they can't communicate the fact that someone is hurting them. And that the whole area of dementia and guardianship is the diciest part of this whole circumstance. Warning signs can really be seen in a lot of places. Many of us can see warning signs particularly in a professional setting. Susan Lilly's here, who runs our geriatric care management program. She's out in the community all the time. We have lots of opportunities to see warning signs in our professional lives, in our personal lives, and many other professionals have a chance to see them. I will tell you, besides APS, who are our biggest partners in this, folks who work in hospitals are often people who understand and recognize these signs. discharge planners, social workers, emergency room staff ask the question to understand the response. The first time I visited the Weinberg Center at the Hebrew home, they were admitting a woman. She had been in the emergency room over the course of 2 years, 12 times. And the emergency room staff was well trained by the Weinberg Center staff, was aware of what was going on, offered this woman shelter, 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 shelter. It was her spouse who was physically abusing her. And finally, on this particular day, the physician offered her shelter and she said, I can't go back there. So they moved her from that emergency room to the shelter at the Weinberg Center with the clothes on her back, and that's all she had. That's what shelter and that's what emergency shelter is really all about. In the general community, one of the things that we look for is changes in behavior. So when someone is socially isolated, for example, if there's someone that you regularly see at services or social functions and all of a sudden they're not there, that's a big warning sign that something has changed. We talk to people in banks. A lot of our older adults love bank tellers. They love to go to the bank. They have a relationship, they go to the same right? They go to the same person every week, they take out the same amount of money, they have a routine. But all of a sudden they're not coming anymore. Someone else is withdrawing from their account. Or all of a sudden this person's coming in accompanied by someone else and everything looks different. Maybe they're in the same clothes they have been in for several days. Maybe they're disheveled when they've never been disheveled before. When we talk to people who work in emergency medical services, police and fire, one of the things we always say is look in the refrigerator, observe the conditions of this person's home, because you may get a clue that something is different, something isn't right. We do a program called Kosher Meals on Wheels where we deliver hot holiday meals to elderly people, many of whom are homebound before the Jewish holiday. And one of the things that we did this year was we sent out our volunteers with a survey form, a little questionnaire that asked them to observe things and asked them to look around themselves and make some notes about what they were seeing. Because that will give us an opportunity over the course of time to recognize whether or not things are changing with this older adult. But all of us can see those warning signs. One of the cases I remember vividly was a referral to Adult Protective Services from a woman who was a beautician. And this elderly lady, the only time she left the house was Friday afternoon to get her hair done. And one particular Friday she was wincing every time she moved. And so the beautician kept saying to her, what's going on? What's going on? Why are you? Well, long story made short, it turns out that this woman's husband had passed away. She moved in with her brother and sister-in-law, and the brother was physically abusing her. And this woman, she was in her 80s, had a number of broken ribs. When APS went to the door, I kid you not, she was in the basement, little tiny frail lady ironing, like Cinderella or something, refused to leave, refused to leave, refused to come to shelter. So APS, bless them, followed up. Every Friday afternoon, there would be the APS person at the beauty shop where they knew she'd be alone, talking to her about the opportunity to come to shelter. It is an opportunity all of us have to recognize, to identify, and to make the appropriate referrals. So why do we need elder abuse shelters? And Elaine and I had a conversation about this very recently because they run a wonderful, important domestic violence shelter here in Bergen County. But why are elder abuse shelters necessary, and what's different about elder abuse shelters? One of the things we know is that the needs of our frail elderly are different than many of the folks who end up in domestic violence shelters. Young women, young children, in a setting that perhaps is not as physically conducive to an older adult as a different kind of setting. The elder abuse shelter movement in this country started with the first shelter at the Weinberg Center 10 years ago, and it really grew out of a conversation that two people who I wish were here today, Joy Solomon and Dan Reingold, had about the need for a place to shelter frail elderly victims of abuse. That putting them in a domestic violence shelter really wasn't working as effectively. Not that it was bad, but that there were other things that these folks needed. Medical services, social services, all kinds of support. That logic, the light bulb moment, is recognizing that in a long-term care facility, in an assisted living facility, all of those things already exist, right? They're here. The core of shelter, as we know, is a bed, right? So all of the other services can be brought to that person. But in this setting, and settings like it, those services exist. They're already here. So for us to admit a victim, into shelter, whether it's in this setting or an assisted living setting, makes a lot of sense. And there's a logic path here that we think is a perfect one to follow. Ezra, I lost where I'm in with you. Okay. Sorry. There are a number of different models for shelter. And just for your educational background, there are really three basic models. The first one is the model that we're talking about now, which is that a victim would come into our setting and be housed here. We will provide a short-term crisis stabilization stay here or at our assisted living. And one of the challenges we have here at the Jewish Home is that we frequently are quite close to full. So if we have a situation with a victim, we'll be talking to Brooke and her team at the Weinberg Center, and the Weinberg Center will be sheltering those victims. And one of our ambulance providers has agreed to transport those victims so that we have a seamless flow for those folks. The second model is what I call the hub and spoke model of shelter. It exists in some communities in Western New York specifically, where there is one organization, often the Area Agency on Aging, that has a designated person who takes those calls, and they have memorandums of understanding with 5 or 6 facilities, assisted living or long-term care. So they call and say, do you have room for a victim? Can you shelter a victim today? That's a system that's working okay for them. It's certainly a good system in areas where there isn't one organization that is taking that leadership role, but it's an important model. The third model in Delaware, they're very blessed, they have state funding for this service. So in Delaware, they actually have housing units in a HUD housing building where people are sheltered, receive additional services, and then have the opportunity to transition into permanent residence in those HUD shelters. So SeniorHaven, which is what we're talking about here today, is our shelter. It is a virtual shelter. So what does that mean? People always say, well, where did you build the shelter? Well, we didn't build the shelter. A virtual shelter means that we can shelter a victim anywhere within our walls, whether in this building or our assisted living in Rivervale, depending on the needs and abilities of that person, or as I said, with our friends at the Weinberg Center. It's a partnership that is vitally important to us, and it is a partnership with many, and I see many of our community partners here who will be really vital to us as we move forward in this effort. Not only is it about referrals, not only is it about having that relationship, but it's also in making sure that that victim has a safe place to go and working with them to make sure that we have a place for them after their discharge. Our friends at Jewish Family Service, I know we have Jewish Family Service represented here, will be helping us in this effort to make sure that from the minute someone is admitted into SeniorHaven, that we're thinking about what happens next. Because it isn't about saying, oh, we're just going to keep you in the nursing home. Many of these people won't need nursing home care. Some of them will require assisted living. Some of them will be able to live independently. Some of them will go home to their own homes with their abuser removed. These circumstances are all different. This is not about keeping victims within the walls of the nursing home. This is about making sure that people have that break in the abuse, a chance to recover, the services they need to recover, and then an opportunity to live a safe and dignified life. Our system is set up that we will take referrals from any professional. We will take referrals obviously from APS. We will take referrals from police and fire, from hospitals, clergy, attorneys. We have an elder law attorney here. We have lots of places where a referral will come from. What we will not take, however, is a self-referral. Why won't we take a self-referral? We have found, and we have learned from our other shelter partners, that we need to have someone really assessing this situation. Our definition of shelter, we are not in the business of solving all the problems of elder abuse in our community, although many of us would like to do that. We're in the business of providing shelter. So it's important for us to define what that shelter is. And that shelter is within the walls of this building or other buildings, caring for that victim, but not going out to solve the abuser's problems, to fix what's going on in the community. That's not our role. Nor is it necessarily, it's not at all our role to go into a home and determine whether or not someone is a victim of abuse. That's why we work so closely with APS. If we get a call from someone that sounds urgent, we may say, you need to call Adult Protective Services, or let us call them and have them call you. If it sounds really urgent, and I've had this call myself, we say, let's get 911 on the phone. The police are very responsive. They're good partners as well. And if they need to remove someone from the home, either on their own or with APS, they will do it. And that's where we understand and define our role. Together, I think it is our opportunity to really raise the conversation and the level of conversation about elder abuse. And I think all of you being here today empowers you. Now you're obligated to be ambassadors for elder abuse prevention in our community. Some of you already are. Some of you, this is new to you, but it is such a vital and critical problem. We often talk about the fact that the level of conversation about child abuse in this country is at a very different place than it was 20 or 30 years ago, right? I had the experience myself of taking my son to the pediatrician, have the pediatrician saying, the circumstance was that Jason decided it was good to slide across the wood floors in your socks. He bit his lip, he really bit his lip. We took him to the pediatrician, and the pediatrician, appropriately so, asked him alone, he was 10 I think, whether or not anyone was hurting him. How did this happen to him? I was grateful that he asked the question. I was also grateful that my son, who could really tease, didn't make up a story. So that's also a good thing. He could live with another family for the rest of his life. But when women go to the OBGYN, we're always asked if we feel safe, if there's someone in our life that's making us feel unsafe. We don't do that with older adults. We don't do that. Susan Greenbaum, who's in the back from JFS, and I had a conversation recently about her parent who had an injury and wasn't being asked questions herself, was asking Susan. So Susan is definitely not an elder abuse perpetrator, but if she had been, and she's answering all the questions, how would we ever know the answer, right? How would we ever know the truth? How would we get to what reality really is? One of the things that I think is so important is that we recognize that the incredible system of domestic violence shelters we have in this country was built out of the efforts of people who have survived domestic violence. That's where it began on a grassroots level. But our older adults are not going to have that opportunity. If they survive, they won't have the wherewithal to be able to do that. And it's important for all of us to play a role in this. We're going to close with a little bit of a video. How many of you know who Mickey Rooney was? He just recently passed away. Mickey Rooney was a victim of elder abuse, and in fact, he testified in the Senate about the abuse. Here's a man that was completely cognitively intact, had a successful career, but he's going to tell you a little bit about the abuse that he suffered.
I have worked almost my entire lifetime in the business I love, to entertain and to please other people. I am here today because it's so important that I share my story with others. I was unable to avoid becoming a victim of elder abuse. Elder abuse comes in many, many different forms: physical abuse, emotional abuse, and financial abuse. Even with success, my monetary thing, called money, was stolen from me, yet stolen by someone close. Many times, sadly, as with my situation, the elder abuse involves a family member. You feel scared, disappointed, yes, and angry. And you can't believe that it's happening to you. You feel overwhelmed. The strength you need to fight it. You can be in control of your life 1 minute, ladies and gentlemen, and in the next minute, like that, you have absolutely, believe it or not, no control of your life. Sometimes this happens quickly, but other times it's very, very gradual. Over the course of time, my daily life became unbearable. Because all of this seemed to come out of nowhere. At first it was something small, and I could control it, but then it became something sinister that was completely out of my control. I felt trapped, scared, used, and frustrated. I came here for you to think of the literally millions of seniors who are abused. You're not alone. And you have nothing, ladies and gentlemen, to be ashamed of. You deserve, yes, you deserve better. You all have the right to control your own life. Everyone does. You have the right to control your life and be happy. Please, for yourself, end the cycle of abuse and do not allow yourself to be silenced anymore. Tell your story to anyone, someone, and let them know. The elder abuse happened to me. That's why I'm here to tell you a little about it. To me, Mickey Rooney. And if it can happen to me, oh, God willing it and unwilling it, it can happen to anyone. I'm asking you to stop this of elderly abuse. I mean to stop it and end it and say it's a crime. And we will not allow it in the United States of America.
Anybody have any questions? We're going to stick around and chat. Anybody? Yes.
Do you go speak to doctors and hospitals? Because
We do.
just like you said with Susan, when I took my aunt to the doctor, he never even looked at her. I would have to, put myself behind her, so at least it looked like he was talking to her. So, I find, forget about even alone. They don't even talk to the senior.
You are
or
absolutely
somebody
right.
else in the room.
You are absolutely right. You know, the biggest piece of this is all about community education. And we will be out there talking to people, but if you have opportunities where you're involved with an organization or in your place of business, some of the best training we do is with people who have an interest in listening to us, whether they're home health people, whether they're medical professionals in any profession, and we'll go tell the story to anybody who will listen to us. Yes, absolutely. Physicians are a huge piece of this puzzle. Anybody else? I had a question.
Sure, you said you don't take self-referrals, but in the event that you have a senior that calls and says, look, I feel abused, I have no family, I'm pretty much by myself, how do you handle that, or what's the next step? And do you get calls like that?
You do, and part of it is weeding out when someone is actually in an abusive situation or when someone has other issues going on. Normally we would call APS or another organization to go and scope out what's really going on, because that's beyond our level. I think we need to be, I remember taking a self-referral on one occasion where I had two adult children show up at the door at Cedar Village with their 92-year-old dad, and he had been hospitalized 3 times, much younger, third wife, I believe, had been physically abusing him, and they were picking him up from the hospital and were afraid to take him home. We had a very long conversation. You break all your own rules in life sometimes. Anyway, we kept him for 3 weeks. It was long enough in the assisted living, very, very high functioning. He only stayed because he thought the women were cute. That's what he told me. And it was long enough for him to be strong enough to press charges against this woman. But he was adamant that he was was going to do that. But every time they took him back to the home, everything was going to be okay, it was never going to happen again. But he was able, the children were so afraid of this woman, they took his car, they took his keys, and they put it in one of their garages because they were so afraid she would drive by and see where his car was. I mean, they were literally physically frightened of this woman. It made a huge difference in his life. You know, you have to play it circumstance by circumstance. But generally speaking, our friends at APS are much better equipped to understand what they're looking at than we are. And we're not going into the home, we're not going to intervene in those situations. We're going to call one of our partners and say, well, we're going to call the police and say this woman feels like she's in danger. I had a referral from a home health agency. People we had trained, the home health aide, said this woman had just come into the home. She said this woman has bruises on her arms. She called their office, they called and said they're concerned about shelter. They called the police. Within 30 minutes, the police called and said this woman is in fear for her life. We said bring her to shelter. You know, you've got to handle this on a case by case basis. Absolutely. Anybody else? Yes.
Yes, if we want to make a referral, who should we contact?
Is the number on the bookmarks, Ezra? The number's on the bookmarks that we gave you. The number's also in your packet, and we will be doing lots of mailings and other materials. But we do have a designated phone line for that shelter.